Good morning, everybody, and I want to wish everyone a happy Valentine's Day on behalf of Protect Our Care New Hampshire. So it was a busy day yesterday. And hi, I'm James Simoes. It's nice to have you all here. Busy day. We had Governor Ayotte give her budget address, and we also had the final confirmation of HHS Secretary Robert Kennedy Jr. And I want to just start off before I introduce our guests in today's discussion to call out our two U.S. Senators, Maggie Hassan and Jeanne Shaheen, who were so involved in not only the process of confirmation and asking very good questions, but in speaking out for the healthcare of Granite Staters. So today I have two guests to talk about yesterday's news and what it means for the Granite State. Phil Sletten, who is the research director of the New Hampshire Fiscal Policy Institute, and Lisa Beaudoin, who is the disability policy professional who works at the Strategies for Disability Equity. So, Lisa and Phil, thank you both for joining us today. Busy day yesterday, but Phil, let me start with you. So you heard the governor's new budget proposal. She's introducing cuts to lower spending now that a lot of the supports that came from the Biden administration are gone. She's talking about a Medicaid copay. What were in terms of healthcare, your takeaways from the address yesterday?
Yeah, great, and thank you again for the opportunity to join you this morning. So it looks like, and we don't have all the documentation yet from the governor's budget proposal, I should say. There are still some pieces outstanding, so we'll learn more in the coming days. So we're working with incomplete information at this point. But in terms of what's in the governor's budget proposal, Medicaid is the single largest program that the state operates, and the governor's budget includes Medicaid just as prior budgets have as well. There are some questions related to those Medicare copays, the Medicaid copays that you mentioned. We don't have a lot of information yet about that at this point. So that is something that, again, we may learn more about that in the coming days as more of the specific text and the framework of the proposal is released. And if we look at some of the funding related to health coverage in the governor's budget proposal, there are still some questions around the payment agreements with hospitals, for example, that expired over this last fiscal year, and the governor's proposal does have those components those budget lines are in the state budget, but those funding amounts may change as we move forward as well. So those are a couple of the moving pieces that I'll be watching going forward. That being said, if we look at health and social services as a category of state budget expenditures, the governor's budget proposal doesn't fund the health and social services category, which is basically the Department of Health and Human Services at the levels the agency requested, but it funds that category at the higher level than the current state budget does. So there's an increase in investment there overall. The governor did highlight some investments in community mental health services, in particular, as a place where she's added additional dollars or proposed additional dollars of investment, which is difficult in a constrained budget environment. Right now, the state revenues are not very strong and below where they were last year at this time. So we're going into a potentially quite fiscally constrained environment. There's not as much money available to add to new initiatives in this budget cycle, or likely won't be, as there have been in the last 3 or 4 budget cycles.
Thank you, Phil. And I just want to point out, I know we've got some folks from the media who've joined this conversation. At the end, they'll be able to ask questions through the chat. My colleague Rachel will share those questions with those on the call. So, Phil, as a follow-up, RFK Jr. is now leading HHS. There's been talk in the Republican budget of cutting national funding to Medicaid. You did a report a few weeks ago. I think $493 million that the state of New Hampshire might lose. I mean, my question's pretty simple here. Was that figured into the governor's budget? And, if we take away that huge amount of money from Washington, what's the impact to hospital funding, public health programs, overall our state's financial stability?
And so Medicaid is a state-federal fiscal partnership and is funded jointly by the state government and the federal government. And the extent to which the federal government pays does depend on which part of the program you're looking at. But the floor, the base match, is a 50-50 match. There are proposals at the federal level that would take away that floor and would mean that New Hampshire's match for basic parts of the Medicaid program, or for most parts of the Medicaid program, would fall to about 42%. And the federal government is also considering, or I should say, members of Congress are also considering reducing the enhanced federal match for the Medicaid expansion program called the Granted Advantage program here in New Hampshire. That federal match would drop from 90% to whatever the floor would be under that proposal, which, if both those proposals were implemented and both were matched at 42%, then that's where a roughly $493 million shortfall in federal funding to fund current services that we're funding in the current state fiscal year um, would have to be made up for by the state. So the governor's proposal doesn't appear to assume that there is one particular set of Medicaid spending reductions from federal funds or another that would come down from U.S. Congress. Those changes, again, we're far from those changes even having lots of detail about those and the timing of those, never mind them actually happening. So the governor didn't include those assumptions, or didn't appear to include those assumptions in her budget proposal. However, a $493 million impact, or if you were to just do some component of those changes and be a smaller number of tens or hundreds of millions of dollars, Medicaid again is the single largest program the state operates in dollar terms. Small changes to Medicaid funding can have a big impact on the rest of the budget. The governor actually has, to balance her budget proposal, did add a revenue source in video lottery terminals. So more an expansion of gaming in the state and gaming opportunities in the state. And that was slated to bring in $117 million in the second fiscal year of her budget proposal. And that helped it balance. It only ends with a $10 million surplus roughly at the end of the 2-year period. So if you were to see a swing in federal funds of tens or hundreds of millions of dollars, that would affect other parts of the state budget and other considerations around health services and other services to fund that Medicaid shortfall, or Medicaid services themselves may have to change to keep everything else in line in the budget.
Thank you, Phil. And obviously, I know as you get more information about the budget and more details, that the Fiscal Policy Institute will come out with more detailed analysis and greater insight into where things are going. So thank you. I want to now pivot to Lisa. Lisa, so again, we were just talking about proposed Medicaid cuts in DC, but also some changes on the New Hampshire level in terms of copays. How's this going to impact people in New Hampshire with disabilities, particularly in terms of access to home and community-based services, specialized care, and support programs to help families and individuals live independently?
Sure. Thanks. That's a great question, and I'm really pleased to be with you all this morning. There are two separate threats to home and community-based services. Those are under a waiver program in Medicaid. It's really important for the public to understand that home and community-based services waivers are not an entitlement protected by federal law like standard Medicaid. They are discretionary, and since the U.S. Department of Health and Human Services answers to the administration sets the tone and the policy. It approves, denies, and shapes the waivers. So Congress is not there to protect them in any capacity. That's problem number one. The second set of severe threats to home and community-based services is that just a couple of days ago, the U.S. GOP's Budget Committee released a revised draft of their budget framework, and it's calling specifically for the Energy and Commerce Committee to find no less than, this means a floor, no less than $880 billion in savings or cuts over the next 10 years. This is potentially an 11% reduction in federal Medicaid spending. And so what does that mean here in New Hampshire, right? So New Hampshire has a 50-50 share in how it funds home and community-based services. So if the feds cut Medicaid by 11%, that effectively renders a 22% reduction in the state's Medicaid funding. And so Medicaid home and community-based service waivers helps people to get dressed, get ready for the day, get to work, go shopping, clean their homes, engage in recreation. It's how people with disabilities have community-based lives. So New Hampshire would face a couple of really difficult decisions, right? It would decide, do we compensate for the shortfall in federal funding with general funds? How do we do that? Where do we do that? Um, would they create a wait list for services for future adults who need home and community-based settings? The governor seems committed into making sure there are no wait lists. Or would they have to cut the budgets of existing individuals, of people already being served? So this could lead to staff who are existing in the system to have their hours cut. And I want to bring up a really important point here. If staff hours get cut, families are going to be put into positions of having to choose between staying in their full-time jobs or making up for the cut hours in their staffing. And having a family member have to leave their employment represents an actual potential economic crisis. So many people with disabilities, they have jobs, they earn incomes, they pay taxes, but they need the paid staff to do much of this stuff. So if their parents have to quit jobs and their staff are being let go, this is an overall negative impact on New Hampshire's economy. This is a bad direction for New Hampshire.
Wow, well, thank you. Thank you both for sharing these insights. I mean, obviously, there's still numbers to crunch, but early signs are worrisome. And so it's important that we have these discussions, and that we work with our friends at Protect Our Care and with the New Hampshire media and others to have this dialogue, because it's important that citizens have a voice and a say in what's happening with their healthcare, their access to healthcare, and the stability of their families. So thank you both very much. I'm going to ask my friend and colleague Rachel to come on and see if we have any questions from our friends in the media who have joined us, and if they want to ask anything of our panel.
Thank you, Jime, and thank you to Phil and Lisa for joining us today. Um, if you are here with us on Zoom and you have any questions for our speakers, please drop those questions in the chat and I will be monitoring and reading those questions aloud. And if you have a question for a specific speaker, please note that in your question. Otherwise, I will read it aloud to the panel and it will go to either. Now we have one question that was submitted ahead of time from someone who couldn't make it today. And this question is for either speaker. And that is, Medicaid often serves as a lifeline for rural hospitals and makes it possible for rural communities to access care. How would Medicaid cuts impact rural New Hampshire communities, particularly for those when they need to access emergency and maternal care?
Lisa, I can speak first on the funding side. So there has been a fair bit of research around, in particular, the effects of Medicaid expansion for adults with low incomes on the finances of hospitals, particularly hospitals in rural areas. And the Medicaid expansion program, if there were to be a reduction in funding at the federal level and the state fully offset it, then there wouldn't be as much of a sort of financial consequence because it would be the same dollars for reimbursement. However, if the state didn't continue the program or funded it with lower reimbursement rates, then we could see considerable financial consequences for hospitals and also for the people who otherwise access health services through Medicaid. Because if they lose Medicaid enrollment, then they're either paying out of pocket, they may be paying for private coverage through some other mechanism that could be more expensive and leave them with fewer dollars to be able to fund other things in their lives. Again, there's a broader economic impact to that potentially. And there's then consequences for health if you're accessing health services less frequently. And that obviously affects provider income as well. So the one thing I do want to note is that Medicaid expansion program in New Hampshire, New Hampshire's a state that has a trigger law, and that law would trigger the end of the Medicaid expansion program if there were to be a drop in the federal match below 90%. So if the state decided to fund Medicaid expansion, and the federal funding match dropped below 90%, the state would have to change that law, probably also change some of the funding structure as well that underlies the non-federal share, the state's portion of Medicaid expansion, and find the money to change not just the structure, but change the amount the state puts forward as well. And if the state owes more, right, if the state pays for a larger percentage of Medicaid, then that may change the state's calculus as to regular or at least significant reimbursement rate increases going forward relative to what the state might have funded if there had been a higher Medicaid match from the federal government.
I think, Phil, that's a boldly nuanced and detailed explanation. I would like to just add that uncompensated care costs for our rural hospitals will skyrocket and put them at risk for not being able to serve their communities at all. I wanted to let listeners know that cuts to Medicaid are sometimes disguised as per capita caps or block grant funding or even work requirements. Those end up being unfair cost burdens to either the states or to individuals. Maintaining work requirement, the administration of work requirements is an undue burden both on our local community providers, our hospitals, as well as our New Hampshire's Department of Health and Human Services. And cuts to Medicaid are very, very threatening to our rural hospital system.
Thank you both for answering that question. Now it appears that is the only question we have for today. So I will toss it back to Jaime, who will also be available if anyone has follow-up questions and wants to contact him afterwards. Thank you all.
Well, thank you, Rachel. Thank you, Phil. Thank you, Lisa. Really good discussion, a lot on the table. In fact, I'd like to have a discussion down the road about how this would impact our rural hospitals. This is a really good point. And we've seen maternity deserts forming throughout the rural parts of our state as hospitals merge. And we can ask the folks in Rochester and Exeter, those mergers often come, and Laconia, with stripped back services and total cuts from maternity care. It's a big issue, and to link this federal funding to how do we develop the economy of our rural portions of New Hampshire is something worth discussing. So we'll do that next time. In the meanwhile, happy Valentine's Day. There wasn't a lot of love in all this, but it's really important to have these discussions. And on behalf of Protect Our Care New Hampshire and our partners, thank you both for being here, and thank you to those who joined us.
Thank you for having us.
Thank you.